Well, today marks the start of National Immunization Awareness Week, an annual event held to highlight and recognize the importance of immunization.
And this year's theme is Don't Let History Repeat Itself. And with the recent uptick in vaccine-preventable diseases like measles, immunization, Canadians is championing everyone to stay up to date on their vaccination. So joining us live now with more on this is family physician. We'd like to welcome back to CP24 Breakfast, Dr. Christine Palmay. Dr. Palmay, welcome to the show.
Thanks for having me.
It is National Immunization Awareness Week, and I want to start by asking you, what are the top 3 vaccinations people should be considering this time of year?
Yeah, so we started thinking about vaccines being seasonal, right? In the spring, we're kind of hopefully out of the throes of Canadian winter. So if I'm to sort of broaden recommendations, and you're thinking about adults over 50, definitely herpes zoster, which doesn't have a seasonality in terms of when we see it in clinics. I would make sure that your pneumococcal vaccine, if appropriate, is up to date. That's an infection that you can get in the community, but also if you end up in the hospital. We have to look at measles specifically now. So perhaps you are not needing a vaccine, but I sure as heck would make sure that your status is updated if needed, with the current upstroke.
Yeah, absolutely.
And doctor, we talk about, getting vaccines and can you get them all at once? Do you have to spread them out? That kind of thing. What's the advice and guidance in terms of, can you literally go in and sort of get jabbed 3 times, or do you have to give it a bit of time in between?
You can get jabbed in most cases as many times as you can tolerate. And, I sort of ask patients what is their preference. Some people like to space them out. They're worried about side effects. Some people are like, I'm here, let's get as much done.
Right.
Certainly in the throes of Canadian winter, when we're vaccinating with influenza, RSV now, and most likely COVID, I'm usually doing 3 at once.
Yeah, and I understand you mentioned the HPV vaccine.
Correct.
And that's very important
so
as well.
Zoster.
Herpes zoster.
But HPV as well.
Okay.
Right? We have new indications. So NACI would say there's no upper age limit. HPV causes cancers, cervical, mainly in women, and we could talk about oral pharyngeal in men. So that's something to think about too, even if you're an older adult.
Yeah, and are these vaccines that are readily available at, let's say, a pharmacist can do them, or most of them you do have to book a doctor?
So in most cases now, pharmacists have access. Some of the public funded vaccines, certainly in Ontario, unfortunately, that's still an evolving area. So that would be something that you go to public health, your primary care physician, a nurse practitioner for. But mainly now, and thankfully, access is a bit more open, and I strongly encourage that my patients, if it's easier for them, get a vaccine at a pharmacy. Even if I'm prescribing it in my office and they have to purchase it, if they don't have to come back, do what's convenient. Just make sure you get yourself vaccinated.
And doctor, from the doctor side of things, if somebody's in there just for something that may not even be related to vaccines, is that something that you would likely bring up with the patient to say, hey, what's your status? Is that kind of your role here as well?
Absolutely. I can tell you that during the throes of COVID, when access was difficult, if your tetanus wasn't updated and you were doing DIY renovations, people were baking bread, there were a lot of lacerations that happened, and it became a nightmare. So I always do a chart scan, and I would encourage the viewers as well just to know what vaccines they're eligible for and what they need.
And you mentioned something earlier, pneumococcal, because I thought, okay, this is just something my kid needs, and once they get to that, 12 years old stage, I can just let them go and not drag them to the clinic. So you're saying if you're 50 and above, this is something you should consider?
So generally speaking, at least in Ontario, we have a coverage shot at 65. So the older you are, the more vulnerable you are. The younger you are, the more susceptible you are. We see that vaccine dichotomy in a number of other vaccine-preventable diseases. But yes, pneumococcal, if you have asthma, COPD, there's different recommendations now based on risk, which I think is a strategy that we are adopting from a public health perspective to, really focus on people most at risk. Age puts you at risk, and then diagnoses.
I'm curious, doctor, what you're seeing firsthand with your patients at your clinic, et cetera, in terms of vaccine hesitancy, because that became something that came up, in the throes of COVID. All of a sudden, there was like this people putting the brakes on either getting more COVID vaccinations or just other vaccines. What are you seeing firsthand at your clinics?
So, I talk about vaccines ad nauseum, and people generally are used to that. I think that, explaining that evidence changes according to scientific research, medicine's entrenched in science, so we provide up-to-date information. So are there too many vaccines? In my opinion, no. We never want to go back in time. And unfortunately now we're seeing the ramifications of a reemergence of measles, which is quite tragic.
Yeah, for sure. Very quickly, Dr. Palmay, for the HPV and pneumococcal that you mentioned, is this an annual thing or is it good for like a few years?
So pneumococcal will vary. Right now, we have a shot and generally say, in most cases, cases is one shot. That may evolve as research evolves. HPV is a course. Guidance is changing in terms of dosing, but generally speaking, once you finish the number of shots you're eligible for, it's for life.
Good stuff.
But
Okay.
for now, who knows what will happen next year.
Well, Dr. Palmay, I appreciate you being here this morning as National Immunization Awareness Week does kick off. Appreciate your time again. Nice to see you.
Wonderful. Thank you so much.
Thank you so much,
Doctor.
Okay.